I started as a hematologist and head of department here in 1994, a long time ago now. And in 1998, in fact, a patient of mine called Roy, who was having chemotherapy cycles for lymphoma, said that it had taken him the first 3 months of his illness to learn how to be a patient. And I said, what do you mean by that? And he said, well, I had to learn the geography of the hospital, and all hospitals are rabbit warrens, of course. I had to learn all these words and the biology of this thing and all this ins and outs of my treatment. And I had to learn who I could talk to or not about what I was doing to look after myself. And that was the phrase that really caught my attention. And when I asked him what he meant by that, he said, well, we all sit out there in the waiting room and tell each other what we're trying. And then we'll say, for heaven's sake, don't tell Dr. X or Nurse Y, because they'll poo-poo you for doing something outside the mainstream. And this is, more than 20 years ago now, and times have changed, but not that much. And with him saying that came the realization that for me as a physician, either I would have to buy into this whole business of complementary and alternative medicine, or forever have a barrier between me and my patients where they wouldn't feel that they could talk to me about everything that they were trying. And really, in business terms, this was an example of people being proactive in managing their illness. And so I did a fair bit of reading around, and I found a bit more evidence than I suspected in favour of some of these so-called alternative, but actually in the right hands, complementary approaches. And so a few years later, the chance came to set up a cancer support centre through a donor. And we started the first centre in Charlie's opened on September the 15th, 2001. And the philosophy with what has evolved into Solaris is to offer a range of complementary therapies that are with accredited practitioners in a safe way, in a supervised way, to help assist with symptoms arising from cancer and with side effects arising from treatment. So we don't claim cures and never have. This is much more about helping people get through the journey more easily. And we've published 10 or 12 papers now showing that for people who choose to use some of our complementary therapies, I'll just make a note to myself. It does help with symptoms, and it does improve markers of mood, if you like, or psychological state as well. And we kind of expected that. What we didn't expect is that there's evidence, and we found a way to measure this, that if people go to a Solaris centre and are offered a chance to try a treatment, they often came back, in my experience, to me, a lot more prepared to answer questions. And there was this effect of this kind of empowerment thing of, maybe I can actually start to manage this situation myself. And I think this applies regardless of where people are on the cancer journey, and regardless of the long-term outlook. And for me, as a doctor, it's immensely gratifying to see people swapping over from a kind of terrified, helpless rabbit in the spotlight effect that can happen to, okay, I've got this, but I can manage this situation. And in psychological terms, the difference is galvanizing and reduces the awfulness of the situation very, very much. So we made a decision not to offer any herbal or oral therapies, and I can talk to you a bit about those if you wish. We concentrated on complementary therapies where there was some evidence base It's very hard to do research in this area. We can't do the standard randomized controlled trials, for example, of Reiki versus non-Reiki. And where there was some evidence where we felt we could have some kind of at my point, on my behalf, a clinical dialogue with the therapists, and set out to do some research, firstly to show that it was doing no harm, and then secondly to see if there was benefit in it. And we haven't been able to do randomized controlled trials, and so the skeptics, and there still are many, say that we don't have proof, but we have an avalanche of anecdotal information that we do an awful lot of good for an awful lot of people. Solaris grew from the original centre at Charlie's to a second centre at St John of God in Subiaco, adjacent to the Jack Bendat Family Comprehensive Cancer Centre, and then a third centre in Bunbury and a fourth centre in Albany. In 2016, we merged with the Cancer Support Association in Cottesloe, and so we have a centre there. And the focus of that centre is more on helping people after their mainstream cancer treatment has finished. And now most recently, with the impact of the virus, a lot of our services have gone online, and we find we're reaching a whole new population, particularly of rural, regional Western Australians who can access a lot of things online. So that's a model that is going to become much more part of mainstream medicine. A lot of you probably already found you're having more consultations by phone or telehealth. Personally, I don't like it. I think you can miss a lot of the important non-verbal cues and so on, but anyway, it's going to be here to stay to a much larger extent than it was pre-COVID. Very briefly on the issue of supplements and herbal medications and so on. With regards to antioxidants like vitamin C and high-dose vitamin C, coenzyme Q, ginkgo, and some others, it's fair to say that across the board clinical trials have been really very disappointing. Antioxidants, you can demonstrate anti-cancer effects in a test tube, but when we've done studies in people, haven't really come up positive in terms of either preventing cancer or preventing cancer relapse. There might be a role for some supplements, and I'm pretty open-minded on this, and I have some reference books that I go to when people tell me what they're trying, and as best as I can give them my judgment on what I think is safe or not safe. But generally speaking, my advice to people is not to take supplements during chemotherapy, because the risk of interactions is very considerable, and they can be dangerous interactions whereby the effect of the chemotherapy agent is greatly magnified, so increased risk of side effects, or even cancelled out, so there's risk of the treatment not working. So St John's wort is a classic which reduces the impact of a lot of chemotherapy drugs. So people who are taking St John's wort, if they don't tell their team, the team might not appreciate that. They're actually only getting about 2/3 the planned dose. A good example of how complex this area is green tea. We conducted a trial of a very powerful green tea extract here in a particular form of leukemia to see if we could prevent the need for chemotherapy in a form of low-grade leukemia. And so in that particular disease, green tea is possibly a good thing. But on the other hand, green tea completely inactivates a medicine called bortezomib or Velcade that we use for a different blood cancer called myeloma. So in that situation, it's very bad. So this is a complex area, and generally speaking, my advice to people is to avoid, or at least tell your team about any supplements you might be taking during treatment. So Solaris isn't for everybody by any means. I wouldn't force it on any of my patients or upon any of you. It's a standing offer. The centre at St John's is funded by St John's, so that's really only open to people getting treatment at St John's, but the other centres are free and open to everybody, and it may help. We have evidence that it does. But more generally, the advice that I give to people under my care, I would like to distill for you, and I hope it's helpful for you. So the first thing I would say is that you need to be confident in the medical plan. By and large, we have a very good medical system and a very good medical oncology system in Western Australia. People have access to, generally speaking, the best treatments that are available. But you have a right to know what the treatment is going to involve, what it's trying to achieve, what the roadmap is, how often you have to come to hospital, what possible side effects are short and long term. And so the first thing I would say to somebody is make sure you know and understand and have confidence in the medical plan. You should be able to talk about it with your doctor. Doesn't matter how important they look, they're still a human being who's trying to help and get a clear understanding of, yes, this is what we're trying to achieve with this particular treatment and the risks are this, this and this. So that's the medical plan. And then the second thing is your own plan. And this is really different for different people, and there's no prescription for this. I have people who come to see me and the day before they send me 10 or 20 questions by email, every consultation. I have other people who come to see me and say, just tell me what to do, doc. I don't want to talk about it. Just tell me what to do. I would judge that's a form of denial and not a great way to handle it. And I would always test people a bit when they come in with that approach. But for some people, that's the way they choose to deal with it. And the rest of us have to respect that. And so between, and your own plan might consist of lifestyle changes. It might consist of lesser or greater amounts of information and research. It might consist of changes to the team of people around you or the circumstances even around you. But you want to get to a point where you can wake up in the morning and then you remember you've got this shitty diagnosis, and then you can say, but this is the medical plan that Dr. XYZ has given me and I understand it, and this is what I'm doing. And I'll talk about what you can do to help yourself in a moment. You probably all had the positive mental attitude thing. People around you saying you've got to be positive. And I think that's a very destructive notion, actually. I think it's much more important to get to a point where you can be calm. There's no evidence that people who are positive have better hard cancer outcomes. And there are plenty of people who feel guilty that they're not positive enough for those around them. And that's why I think it can be quite a destructive notion. But if you can get to a point where you wake up in the morning and then it hits you again and then you say, okay, but this and this, I've got this under control as best we can, and be calm about it, then I think that's going to lower stress levels, and that certainly I think could help your immune system work a bit better. After that, if there's any one thing I think people can do to help themselves through cancer and after cancer treatment, it's exercise. And we've kind of gone through three stages with the exercise advice. 25 years ago, if people felt tired, then we'd say, well, you need to rest. Turns out that's bad advice. And then about 10 years ago, we'd encourage people to go for walks. And that's better advice, but still not actually the right advice. All the evidence now is that exercise during chemotherapy is safe. It doesn't promote the spread of cancer. It doesn't increase the risk of side effects. It probably reduces the chance of side effects. And the right kind of exercise needs to involve a little bit of light resistance type exercise. And the reason for that is that most chemotherapy medicines and prednisolone, dexamethasone that are often given with or as part of treatment, in the case of lymphoma at least, tend to make you lose muscle. They're catabolic for muscle. And fatigue is by far the commonest symptom for people after chemotherapy, and it can persist for years. And it's not until you give them an exercise prescription that includes some resistance stuff, because the only way you keep or get muscle back is to use it. And a lot of people neglect the upper body muscles by just walking. So a little bit of light resistance stuff will reduce the levels of fatigue. And we're not talking about training up for a marathon and aiming for a personal best. You have to reset the bar for people who are used to very high levels of exercise before their diagnosis. A rough rule of thumb is don't exercise so hard that you can't finish a sentence, as a rough rule of thumb. And if you're recovering from a pretty intensive period of treatment, then cut yourself some slack. The overall trend should be to get better each day, but there might still be bad days where you go back a bit. But generally speaking, gradually escalating your exercise levels gives you the best chance of getting back to feeling something more like normal. With regards to diet, for people who are on chemotherapy medicines, I'm talking the traditional chemo drugs. Chemotherapy means medicines that kill dividing cells. And by definition, that's the bad guys. But there are also some normal cells that are dividing in adult life, like the hair follicles and the bone marrow making all the blood cells. So the two commonest side effects of just about all the traditional chemo drugs are hair loss and low blood counts and risk of infection. And so you actually need a diet that helps your bone marrow make blood again. So that means plenty of B12 and folate and iron. B12 is in animal dairy products. It's pretty hard not to get enough folate if you have any kind of fruit and vegetables. If you don't eat meat, then lots of the dark green vegetables, basically like spinach and broccoli, should get people enough iron. If you do eat meat, any kind of meat, 3 meat meals a week usually is enough iron. With the diet, there is a lot of stuff out there about anti-cancer diets. From what I have seen, I'm afraid I've seen a lot of very harmful diets about, for example, trying to starve the cancer cells of sugar. I'm afraid cancer cells are very greedy and they will take whatever sugar they get preferentially. And all you're doing is starving the normal cells of the body even more with that particular diet. There really isn't any diet I'm aware of that is effective against cancer per se. The only dietary thing I'm aware of that helps the immune system, for which there's some evidence, is particular kind of mushroom, shiitake mushrooms, and that's uncontrolled and unscientific, but there is some test tube evidence. So I would say the best thing to do is just a normal diet covering the food groups. And if you've got nausea from your treatment, as tends to happen with cisplatin in particular, then don't try and have big meals, just try and have snacks, really, or whatever you feel like. A lot of people get an altered sense of taste during chemo because it affects the taste buds as one of the dividing groups of cells in the body, and that can make it really hard if that's happening. But just having snacks frequently to get their calories in, if you've got a lot of nausea or worse, is a good thing to do. So exercise, diet. With regards to stress, there's no good evidence that stress causes cancer. There's very clear evidence that stress has measurable effects on parts of the body. High levels of stress impair wound healing. High levels of stress blunt your response to vaccines. High levels of stress change the aging mechanism called telomeres in the white blood cells. But none of this really seems to contribute to an increased risk of cancer. And I could quote some very specific studies done in New South Wales. There's a little bit of evidence that major stresses can increase the risk of relapse of cancer. And so my advice to people is that where you can identify an obvious and recurring constant source of stress, then resolve it if you can. And actually, I would flip this around and say, as much as possible, get your life how you want it to be. Carl Jung, live your own myth. If you wake up in the morning and you're doing things that make you feel good about life and good about yourself, good diet, good exercise, it's not a very scientific thing of me to say, but I believe that helps your immune system and that helps manage this kind of situation better. And actually, when I'm talking to medical students and doctors, I would say if it's good enough for people we look after, then it's good enough for health professionals as well. To give you an example of this, I said this to Roy a bit later, and Roy was running a hardware shop, and he came back a month later and said, I realised that on Sundays I was wholesaling for all the tradies. It was 20% of my business and 80% of my stress, and I decided to stop dealing with wholesalers. And so he cut his business down a little bit and stress levels dropped away dramatically. It's not always possible to make that kind of life change, but generally speaking, we are looking for ways to find the best in a bad situation. I read a couple of years ago Lee Sales' book, Any Ordinary Day. You know, she's a journalist who runs the 7:30 Report. And she talks about how people respond to major disasters, like the Thredbo disaster and the Port Arthur massacre and so on. And I realised a fair way into, not too far into the book, that really this was a bit of a busman's holiday for me, because for everybody that's diagnosed with cancer, this is their major disaster. This is often the worst day of your life. And one of the things that she talks about in her book is this concept of post-traumatic, not stress, post-traumatic growth, which is that out of a really traumatic, stressful, life-changing, life-threatening situation, sometimes people emerge with a much heightened sense of the enjoyment and appreciation of life. And actually, intuitively, that was kind of part of the reason why I started Solaris, that I wanted people to get to the best chance of this post-traumatic growth, where after this experience, even if it's not curable, life is in some way richer and more valuable and more enjoyable. And, you know, this is not always possible, sadly, for people to achieve by any means, but the kinds of things that help people to possibly have this kind of outcome include having access to counselling, include having a good support team, include having an open and good relationship with your medical team and nursing team and so on. I have a colleague in Sydney who's written a beautiful paper comparing the diagnosis of cancer with Lord of the Rings. And like Frodo, you need your Sam, and you need your dwarves, and you need the king of the elves. You need all of these people. You need the Ents, which she describes as the medical administrators, the slow-moving people in the background. All of those people are part of the team that help you deal with the burden. So there can be some positives that come out of what is such an awful situation for many people. In a little bit more advice that I would give to my people is to say, if you can, appoint a spokesperson outside of your household. somebody that you can up to date, and then they can up to date everyone else who wants to know. And then you're not getting phone calls and having to talk about this all day, every day. So a spokesperson outside of the hospital. The other thing that I warn my patients about soon after diagnosis is the impact of telling other people, and to warn them that we have a very cancer-phobic society, and some people won't know how to deal with this, and their inclination will be to try and avoid the situation and not talk to you, which can be very hurtful. And some of you might have experienced this. On the other side, some people come out of the woodwork as really true friends that are there and emerge as much deeper level of friendship than before. I would say that most people around somebody diagnosed with cancer take the lead from them in terms of how much they want to talk about it or not. And the rest of us have to respect that person's choices about that, and indeed about how they manage their illness, and indeed what treatment they choose to have for it. Fundamentally, that is a person's right, I believe. Then I would say, particularly to a kind of general audience, the practical things in my experience that people appreciate by way of help specifically is meals and transport and babysitting. And that's a useful thing to offer if you're knowing somebody going through this, or those are useful things to offer. The last piece of advice that I would say to people, and this came from a lady I was looking after who came over here from New South Wales, and she's written a book which we hope is going to be published soon, a very powerful book, and that is to trust your instincts. That is, if you feel something's not right, then it's probably not. Sort it out, ask questions, get more information, seek out those people that are helpful for you, that you want as part of your team. All right, so let me just check my slide here and see if there's anything I've missed out. No, I think that's it. So that's enough from me. I'll throw it open now for questions, and I'll try and answer them as honestly as I can. And I'd love to hear your reaction to the things I've said. I'm not an ovarian cancer doctor. I don't pretend to know about it. I don't know what it's like to be told you have cancer. I think I've got a pretty good idea, having had those discussions several times a week for over 20 years. But I always find that the lived experience is the most powerful messenger. So, any comments?
Can I just ask you, I get a lot of people telling me to get that, is it marijuana oil for pain?
Right.
Because I've got a lot of pain in my abdomen, because that's where the cancer is.
Yep.
At the moment. And that's, like you say, you get all these people telling you, you know, this is what you should take and that's what you should take and things like that. But I've never asked them at the hospital about anything like that. So I just wonder what your view on that would be for cancer patients.
Yeah, look, the first thing I'd say is it's not an anti-cancer medicine. It's not a treatment as such.
Yeah.
The second thing I'd say is there's pretty good evidence, even published in the top medical journals, that it's good for nausea. And there's emerging evidence, it's still not quite as strong, but I believe good enough evidence to say it's useful for pain in some people as well. Depends a bit on the cause and type of pain, but in Western Australia, the process for getting it now is pretty streamlined. The health department has set up particular people who are more frequent prescribers of it, and there's a mechanism that should be accessible. Discuss it with your team. You may find some medical resistance. There's a stigma attached to it, which I'm sure you're all aware of. But if you make it clear that you're not looking for a panacea or a perfect answer, but really something to help with pain that can avoid the strong painkillers, then there's a good case, I would say, for trying it.
Okay, thanks.
Okay, anyone else?
I have a question about, you talked about calmness as being very important rather than positivity per se. I was wondering about what you thought about courage as being a really important thing when we're faced with these sorts of issues, of just being able to find a way to deal with it.
You know, when you look at how the media talk about cancer, it's in a very simplistic and subjective way, and they always talk about it as either victims, or if it's somebody famous, a celebrity with it, they seem to somehow be a warrior fighting the cancer. The thing that's impressed me most over 25 years is the courage that everyday Australians show, day in, day out. And there's a courage in squaring up to the diagnosis. There's a courage in saying, okay, doc, let's try this treatment. I know it's going to be rough, but I'm prepared to go through it. Actually, that's reminded me of something I wanted to say. So actually, I see no lack of courage. I think most people show far more of that than the lay public and the media realise, actually. I see great dignity and courage in ordinary people. I was involved in treating somebody I've been at university with, in fact. She was diagnosed with a lymphoma. We treated it. She came back sometime later with her 14-year-old daughter with her, and I had to tell her that it had relapsed, and her daughter wasn't able to cope. She was screaming and yelling and throwing herself around the room, and my ex-university colleague just squared up to it within about 5 or 10 seconds and said, okay, what do we need to do? And then turned to her daughter and said, we can manage this. Now that's incredibly courageous. She was probably feeling like her daughter was looking. So that said, sometimes courage can be misplaced, and sometimes people are courageous for the sake of those around them rather than themselves. And I sometimes get the feeling, particularly with a couple, that the patient is going through with this for the sake of their partner to be seen to be doing all they can when their heart's not really in it. If I sense that that is happening, I will make a point of saying to my patient, with the partner or family members present, very clearly that they have the right to tell me when they've had enough. That people have the right to say, okay, look, we've tried this and this and this. For me, I can't take any more treatment, thank you. And I'm very careful to do that with family members present so that it's open and out there, that there is permission for people to say enough is enough. You know, as doctors, we want to do all we can with the very best motivation in the world. But fundamentally, as I said, we have to respect people's right to make those decisions for themselves and not for anyone else. The comment I meant to say earlier with regards to chemotherapy is that it has a bit of a stigma attached to it. We've gotten a lot better at the anti-nausea stuff and the anti-infection stuff and the antibiotics and so on. I still have people coming to me and saying, well, I don't want chemo because it's going to wreck my immune system. And I would say that I view chemotherapy as like making an investment. And the investment that you make, the cost of the investment is not necessarily the financial cost, although that can be considerable, I know. But it's the investment in the time and the visits to the hospital and the side effects and the uncertainty and the risk of infection. Most of those things are short term, and the return on the investment, if I can use that cold business term, can be life itself, or a period of many years where you don't need active treatment and can get out and enjoy life and do things. And for some people, when it's put in those terms, then they're a lot more prepared to wear the short-term impact of treatment. And for a lot of the things that I look after, chemo works. It's been given to tens and thousands, hundreds of thousands of people, very carefully measured in terms of the possible risk of side effects. Rare reactions still occur sometimes that we don't predict, but by and large, we've very carefully worked out the safest possible dose for the maximum possible effect. And I'd be very, very wary of believing that somebody else's chemo is the right chemo for you. Everybody's different. Everybody has a different physiology and a slightly different version of a type of cancer. And so we would always be very careful to say, for example, in a group counselling thing, don't compare yourselves with other people. Everybody is different. And in this day and age, treatment should be individualised. But yes, courage. I am enormously, I feel a great privilege to see how people handle this kind of situation week in, week out. It's a great thing.
I just had a comment, and I guess thinking about what you said about nominating somebody outside of the household, I think you said, as a spokesperson.
Yep.
And I think I feel people, it's a really good idea, because I feel that people get so bombarded with having to do all those social things. It's just overwhelming. I guess hard for people if they don't have that person. And it comes back to also about the team that you have and the support that you have. If you have those people, it's wonderful, but for those who don't, it's hard.
Yes, and again, you have the right to say, look, please only phone me once a week, or please only phone me once a fortnight, or please wait until I get in touch with you next, and ration the energy that you're giving of yourself to others, because you need to spend the energy on yourself, if I can put it that way. Anyone else out there?
Could I just say, it's Stephanie from Canberra.
Oh, okay. I didn't realise we were interstate.
Yes. My husband's found it very difficult coping with my diagnosis. And whilst I've been on the journey for quite some time now, and I've just gone through another, what I call a relapse, I find it very difficult, because I'm, like you said, I'm always trying to put my chin up and kind of support him, when I'd really love him to turn around and try and support me in some small way. It becomes very difficult. And now I'm getting to the stage where you just talked about whether or not, if I've got to have further treatment, whether I'm going to have it or I'm not. I've got to the stage now where I'm really tired of fighting.
Yeah, so that's a dilemma that can face a lot of people. Both of those are dilemmas that can face a lot of people. With regards to your own situation, you need to be able to talk to the team and get good and honest information. Yep. It's not always possible to give it, but if I have somebody ask me, what's the prognosis now, Doc? It might be a philosophical question, but more often than not, it's a practical question about, what do I do about the planned holiday in a year? What do I do about the grandson's wedding in 18 months? People want to plan, and that's a question that needs, as best as is possible, an honest answer so that you can plan or make a decision about more treatment or not. And so, yes, before you make any decision about that, I would say you need to have a discussion which says, what are the pros and cons of going on? And you should be able to have an honest discussion about that. Unfortunately, the evidence is that we as doctors are often way over optimistic on people's prognosis. Again, for the best of reasons, we want the best to happen. And I hate to say it, but my experience is there's some cowardice out there where doctors find these conversations hard and shy away from giving you a really good estimate as best they can, because we know that we'll be held to it and because we know we're often wrong. And so it's a difficult discussion to have, and sometimes I have to be pretty vague, and I might say, well, if you ask me if it's weeks or months or years, then it's months now, not years. And that can be useful for some people, and it needs honesty, because you know, in a way, medicine's the only profession with 100% failure rate. We don't have immortality, and part of the job here is to give people the best possible chance at the best possible life that's available. With your husband, I would recommend, if you can, ask the team about whether there's any counselling available for you as a pair. In my hospital, we have a psycho-oncology counselling service. Most of the cancer councils across Australia have access to something like this. He may find it hard, and he may not be able to face up to this, but I think that's your best chance of getting it to happen. Needs a bit of professional help where you can be honest in a safe space and talk it out.
We have been, David, but it's still, you know, it's just like he's devoid of what's going on.
I can assure you he's almost certainly not, but doesn't know how to express it. There's a famous story amongst health professionals that somebody I know was running a counselling session, actually in New South Wales, for women with breast cancer, and the counsellor was talking about support from partners, and this farmer's wife said to her husband, "Yeah, look, listen to all of those stories. How come you never tell me you love me?" And the farmer sort of, as the way Australian men do, crossed his arms and sat back in silence. And the session went on for another half hour, 40 minutes or so. And then just as they were closing up the session, the husband stuck his hand up and said, "Look, I just want to say one thing before we close." And he turned to his partner and said, "I told you I loved you on our wedding day, and if things change, I'll let you know." So unfortunately, Australian men aren't great at this communication stuff always, but the love will be there, I'm sure.
Thank you.
That when my dad, who had cancer, and he was an elderly chap, we wanted to talk about what was happening and he refused to talk about it. And I was speaking with the hospice lady and she said, "You're way on a different part of the journey than he is, and denial is a form of coping. That's how he's managing right now." And although I found that difficult, it actually helped us be able to go on the journey together a bit better, you know, because the more we tried to force him to talk about it, the harder it was for him. So I always try and keep that piece of advice for me a bit.
Yeah, I have people who come in and say, "Don't tell me anything, doc, just tell me what to do and I'll do it." And sometimes people will say to me, "We're going to beat this, aren't we, doc?" And that's a question, actually. And so in those kind of situations, I'll always kind of put a gentle feeler out and say something like, "Well, you know, actually, I hope you realise the chances of success is X, Y, or Z, and you do need to know that." And if people choose to continue the denial thing, well, then that's their choice, and we have to respect that. But it does make it hard. yes, or harder. But knowing that that's happening can help you manage it, as you've just said. All right, guys, seem to be getting towards the end of questions. Has this been helpful for you? I know it's stirred up emotions in some. I am very honest about this stuff. I don't mean to cause distress, I only mean to help people manage the situation. Are you all comfortable with where we've got
Yeah.
in this conversation?
Yeah.
Thank you.
I think it comes up quite a lot, this idea of being an advocate for yourself, and it's an interesting thing that you're talking about the complementary therapies and the Solaris Centre as a way of building up some self-confidence, I guess, to do that.
Yes.
Yeah, it's really lovely. Mm.
Yeah, with regards to complementary therapies, I probably should have said that where we're at the moment with this is that there's good evidence that, for example, massage of different sorts is particularly good for anxiety in cohorts of people with cancer. Acupuncture is very good for some sorts of pain and for nausea, particularly when it's done a certain way involving a pressure point on the left wrist. Music therapy, which can be active, where you bang a drum or try and learn an instrument, or passive, where you listen to music, is very good for mood. And so when I started Solaris, my original plan was to just get therapists in and give people a choice, and then start to push people towards certain therapies that I thought would be most likely to benefit. But after a couple of years, we dropped the second idea because we found that this issue of people coming in and making a choice was so empowering and so valuable that we've kept that as the model. And so we let people wander into our centres and try whatever they want. And there might be a different thing each week, or they find a therapist they like and then they keep going with it out in private. That's okay. We do have a kind of coalition of similar-minded centres. Solaris was the first one in Australia, but the Chris O'Brien Lifehouse, there's a good doctor there called Judith Lacey, who is fantastic. The Olivia Newton-John Centre in Melbourne, I think it's Broome Hill Centre in the Gold Coast. We have this loose coalition of like-minded centres offering similar sorts of things. Flinders have a centre starting up, although they've been a bit slow. And of course there are practitioners out in private. So it's not for everybody. Some people are enormously uncomfortable with some of this Eastern type stuff. For me, they offer sometimes a kind of a healing which I think is really important if we can't cure. So cure is where you eradicate, in this case, a cancer. But healing is where you get to the best possible place you can, despite whatever hand of cards you've been dealt. And I, you know, in quality of life studies, you can have somebody who's diagnosed with a very early stage cancer that's cut out like breast cancer or melanoma, looks like they're cured, but they're not coping and in huge amount of distress. On the other hand, you can have somebody who knows that they only have weeks left, but they're happy. They've realised and they've got to a point where they're happy with that situation and they're managing it and they're doing what they need to do. And so perception is reality with quality of life, and there's no objective measurement of it. And so the more that we can help people get to a place mentally where they feel they are able to cope, the better.
You know, I find this might sound silly to you guys, but I'm a real Elvis fan. And this year I've really got into since 2018 I've been having treatment, and this year I'm really in the depressed, really down sort of time, lots of times. And I find when I turn the TV on, and I put Elvis on and watch him, it really picks me up. Like the music just, you know, gives me that lift, and I get out of my like depression stage for a while, and while I'm listening to the music. So I agree with you, how you can say that people find it in music, and you know, it just picks me up.
Yeah, there's studies been done in the University of Western Australia that show that good mental health, at least in the general community, is more likely if you do about 2 hours a week of something creative, which might be just listening to music, but something that is dedicated to mindfulness, where your mind is entirely involved in something else. That, you know, used to be meditation was aimed at the inward journey and focusing and emptying your mind. Nowadays, the meditation stuff is more towards filling your mind with other stuff, really enjoying something for a period of time that enables you to forget about what might be a pretty crappy situation otherwise. So mindfulness is the catchphrase, but and I say this to medical students and to colleagues, you know, my particular therapy is music. I play in a band and I busk and I write songs, and for me, I'm totally when I'm playing my guitar, that's it. There's a guitar and nothing else, and that's a great space to be in for me from time to time.
There's quite a few Elvis movies in the back catalogue.
Yeah, there's a few around.
Yeah, he's a great singer.
I had one final question. Now that with COVID, how can people access the Solaris services online? Can you just briefly say a little bit about that?
Yeah, we do have a lot of services online since the virus struck. We closed our centres because of the evidence from China that people with cancer were at increased risk of more serious complications from infection with the virus. We reopened them in late July. We don't have community spread in WA at the moment, but in the hospital we've taken the virus very seriously and continue to do so. So actually, interestingly, there was a paper in the Lancet, which is one of the most respected medical journals, in June, which suggested actually that people currently on chemo may not necessarily be at increased risk of bad consequences of an infection, which was a bit reassuring, but nevertheless, the advice we're giving people here is pretty clear about avoiding the virus. But www.solariscancercare.org, I think it is. I'll just check that. I'll just give you the proper address. Yeah, solariscancercare.org.au. And a lot of our counselling things went online. There's short 5-minute home exercise programs from some of our exercise people, and so on. And look, I hope you find it useful. Yeah. All right, everybody. I do hope that's been helpful. I'm not a medical oncologist. I'm a hematologist. I think that issues are fundamentally the same across the board, whether it's a low or a high grade cancer, whether it's curable or not. It's all about getting to the point where you feel like you've managed it the best you can and you've done the right thing by yourself.
Thank you so much, David. That's been really fantastic.
Thank you.
I would love some feedback. I think one of you at least has my email address. I'm very happy for that to be circulated and to get feedback and more questions if that's helpful.
Yep, I can arrange that.
Okay. Thanks everyone. Good luck.
Thank you.
Thank you.